There are many people in the United States who do not get the health care services they need.
In fact, according to the Office of Disease Prevention and Health Promotion, this can be due to a lot of things like high costs, lack of public transportation, or an inability to communicate. There are a lot of doctors' offices that are also closing, and the barriers are growing. Barriers to health care is our big story today.
Poverty is directly correlated with poor health outcomes in the U.S. According to the U.S. Census, there were more than 36.8 million people in poverty in 2023. That's a slight drop from 22. According to the National Health Council, a nonprofit association of health organizations, people who live in poverty tend to have a higher disease burden. Poverty also has a higher rate of death for people with certain chronic conditions such as heart disease, liver disease, and kidney disease. Poverty can also often create barriers to health care for low-income families, such as a lack of health insurance, poor access to public transportation, and limited health care resources.
Another big issue here when it comes to healthcare barriers is the lack of access. According to GoodRx, more than 80% of the U.S. lacks adequate healthcare infrastructure in some shape or form. That means more than a third of the U.S. population lives in a county where there's less than adequate access to things like pharmacies, primary care providers, hospitals, trauma centers, and low-cost health centers. In Wood and Lucas counties, there are a lack of hospital beds that are adding to those healthcare barriers. And a new healthcare clinic may be coming to Toledo's east side, but there's some opposition to the plan.
It's not opposition against the clinic itself, but the location of this one. I-Team reporter Sean Hegarty is live with us in the studio, new at 4:30. Sean?
Yeah, Tony, the issue is that location. Right now, the idea is sitting with the Plan Commission in Toledo-Lucas County because the property would need to be rezoned. Many on Toledo's east side will remember that spot on Navarre Avenue near Woodville Road as a former East Side Central Elementary. The Toledo-Lucas County Planning Commission now has a proposal in front of it for that site to become a health clinic run by Health Partners of Western Ohio. The only problem right now is that the Planning Commission staff is recommending disapproval. This health clinic would require a zoning change. Right now it's residential, and the hope is to change it to mixed commercial residential. The Plan Commission staff saying in its report that the commercial change would change the residential makeup of the area. Some use the spot right now for recreation.
So it's like people take their dogs, let them run in the summertime. Sometimes kids will come over here and play football.
Tomorrow is the first step in the public process at a Planning Commission meeting to see what the commission itself says about that. The final decision comes down to the full Toledo City Council. The council could get it for a vote in mid-March. Tina?
All right, thanks, Sean. Another issue facing the healthcare industry is the lack of healthcare workers. According to the American Hospital Association, a 2024 study finds that the U.S. healthcare labor market will see a shortage of about 100,000 workers by the year 2028. According to the American Association of Colleges of Nursing, the country will need more than 200,000 new nurses every year until 2026 to fill new positions or replace those nurses that are retiring. The shortage is partially due to the aging population, with 48% of the U.S. expected to be over the age of 65 by 2032. This, of course, increases demand for workers in the healthcare industry, and the shortage of healthcare workers will also put a strain on geographic and demographic disparities when it comes to access to care.
A new study also shows many nurses and other healthcare workers face strains on their mental health, causing many to leave the industry before retirement. Alexis Cruz takes a look at the numbers.
The COVID-19 pandemic may now be 5 years in the past, but a new study is highlighting large care-seeking gaps among healthcare workers who faced mental health issues during the height of the global crisis. The results are causing concerns throughout the medical field.
We do see increased rates of anxiety, stress, depression, PTSD in healthcare workers as a whole.
In the throes of the pandemic, surges of COVID-19 patients were overwhelming many understaffed hospitals nationwide, triggering intense burnout, chronic stress, and mental agony among practitioners. After surveying more than 2,600 healthcare workers from September 2022 through May of 2023, teams found
26% of them were reporting levels of mental health problems that would be on par with meeting criteria for a diagnosis, a mental health diagnosis. What was interesting is that only about 40% of these people had sought any kind of mental health care. And really only 20% of them said that they didn't even need care at all.
Researchers are identifying key reasons that prevented workers from getting help.
Things like getting time off from work or just the cost of care.
Psychology professionals also cite ongoing stigma surrounding medical workers getting mental health care.
It's related to things like licensing and board certification or, concerns that they be seen as weak.
Researchers say supervisor support helped decrease some of the negative effects in workers. Advocates are also calling for ramped up trainings on managing employee stress and staffing issues.
And of course, we will stay on top of healthcare disparities in the U.S. and what's being done to solve the issue, as well as any decisions that are made about that clinic proposed for East Toledo. You can stay in the know by downloading the 13 Action News app. It's available for free in your phone's app store.